Hello students, welcome to the discussion of the MCQs on the hypothyroidism. In endocrinology, today we will be covering the topic of hypothyroidism. Full-term baby was born by normal delivery to a second gravida mother after a normal pregnancy. Birth weight 4 kgs, that is increased, and that is one of the sign of hypothyroidism. Length was 51 centimeter. Cord blood TSH level was 608 and total T4 was less than 1. Normal range is this. Next step in the management is, now you can think of particularly the TSH is increased, T4 is less. What is being given? TSH is increased and the T4 is particularly decreased. So you should think that we should immediately start the treatment. But after birth, there can be TSH surge in response to a cold in a normal neonate. So if you basically see like this, there can be a normal TSH surge. And this normal TSH surge, it comes down in 48 hours. So in order to make a diagnosis, in this case, what you should do is TSH should be repeated after 48 hours. So in this case, you should repeat the thyroid stimulating hormone. It should be repeated after the 48 hours, and if it is still found out to be above 40 international units, then we start thinking of starting the levothyroxine. So you should repeat, that is the right answer. Thyroid ultrasound, thyroid scan, they should be only done if once you have made a diagnosis of congenital hypothyroidism, then you will look for finding the cause. And then you find out. Mother thyroid function test should be done. No, you should ask the mother whether there is history of taking any anti-thyroid drug during pregnancy. Right? That is one of the causes where the cord blood TSH level can be increased. Clear? So here the right answer should be TSH should be repeated after 48 hours. Second, term baby was born by the caesarean section. Birth weight 3 kg, length was 48 centimeter. On day 3 of life, now you see here day 3, the time of TSH surge has gone. TSH level was 552. On inspection on visualization, thyroid gland was not visualized. Thyroid gland is not seen at all. Child was started on thyroxine. Now the child age is 36 months and parents are worried about levothyroxine. On thyroid scan, thyroid gland is again not visible. Right? Thyroid gland was not visible at that time also. Thyroid gland is not visible today also. So this becomes a case of thyroid dysgenesis, and this is most likely aplasia or hypoplasia, and in this case most likely aplasia, as the thyroid gland is not visualized. And if it is a case of aplasia, what we need to do is we need to tell to the parents that levothyroxine would be given lifelong. So parents should be advised, explained. Now you can only explain when you have made a diagnosis of thyroid gland dysgenesis. So pick up the clues and make up the diagnosis. So this is a case of thyroid gland dysgenesis. Question number 3. Term baby, birth weight of 2.95 kgs, length 50 centimeter, have history of hypoglycemic seizures, polycythemia, prolonged hyperbilirubinemia, and required to exchange transfusions. Right? Now at the age of 9 months, there is delayed milestone. Right? Now if you first see these points particularly, hypoglycemic seizures, polycythemia, prolonged hyperbilirubinemia, this can very well be explained that the mother had diabetes, and this might be a case of infant of diabetic mother. Right? But there is nothing mentioned here. Our actual question starts after this. Now at the age of 9 months, there is delayed milestones. TSH is 23 and baby was started on thyroxine. After 1 month, TSH is 3.4. Advice given to the parents will be, now you have just started the thyroxine, it has only been 1 month, and the thing is TSH is corrected. Now the parents will say that TSH is corrected. You should advise continue the same dose. No need to do the TSH again. TSH should be repeated after at least 3 months, and then the decision should be taken whether to decrease the dose. Right? It cannot be taken after 1 month. So in this case, we should continue the same dose as of thyroxine. Thyroid scan should be done. Thyroid scan is mostly required in the cases of thyroid dysgenesis, and that is when the child mostly manifests at birth. Here the child has manifested at 9 months of age. Stop thyroxine at least after 6 months. You should take a decision after 3 months after going for the TSH test. So you should advise the most appropriate answer is continue the same dose of the thyroxine. Question number 4. A 10-month-old child is brought to the hospital with thyroid swelling. That means thyroid is present. The child has abnormal weight gain, decreased activities. Increased weight gain, decreased activities both can be the sign of hypothyroidism. On examination, TSH is increased. If TSH is increased, that means pituitary gland is present. Otherwise, who will produce the TSH? So this indicates pituitary gland is present. You are seeing thyroid swelling, that means thyroid gland is present. Thyroid gland is present, right? Most likely the cause of this disease is, if you are seeing the thyroid gland is present, that rules out thyroid dysgenesis. If you say TSH is increased, that rules out central hypothyroidism. That rules out central hypothyroidism. So what is the right answer left? That is the thyroid dysharmonogenesis. So there might be some defect in the thyroid hormone, particularly synthesis. Maybe defect in the enzyme peroxidase. Maybe defect in the enzyme deiodinase. Right? So basically here you need to understand, I have excluded the two, so I have come to the answer. Most likely answer can be the thyroid dysharmonogenesis. Fifth, 6-month-old child with complaints of crying very less and sleeping most of the time comes in clinic. That means child is lethargic, because cry is a normal thing in a child. Child is crying less, sleeping, child is lethargic. On examination, the baby has poor head control and is not yet reaching for the objects. Skin dry, hypotonic muscle, mild pallor, no teeth. Right? Mild pallor, no teeth, anemia, because in hypothyroidism, what you get is the macrocytic anemia. You get is the macrocytic anemia. Rest of the physical examination is normal. Most likely diagnosis is. Now here given is a 6-month-old child, and 6-month-old child, what we assume, unless history is given, the child must be on exclusive breastfeeds. And celiac disease mostly manifests after 6 months when you introduce the cereals into the diet. So that is not the case. Growth hormone deficiency, what you need to understand is, in growth hormone, the rest of the physical examination, there might be some changes in the physical examination, and in that case, hypotonia, skin dry, that is not seen. 21 hydroxylase enzyme deficiency, if it is a salt losing form, it usually manifests at birth. So out of the answers given, the most appropriate answer is the hypothyroidism. So the right answer is the hypothyroidism. Right? Thank you all for the discussion. These were the questions on the hypothyroidism in children.